Hello, my name is Dr. Sourav Das. I am a consultant psychiatrist with Somnos Sleep Clinic. I am also attached as a visiting consultant with Medica Super Speciality Hospital Kolkata and Iris Multi Speciality Hospital Kolkata. I work as a consultant psychiatrist dealing with various kinds of patients, including those suffering from schizophrenia. And I do deal with general adult psychiatry, particularly those who have various kinds of psychotic disorders and addictive disorders in my routine clinical practice. So to talk about the risk factors of schizophrenia, as I had mentioned, it is a like neurodevelopmental disease, a disease of the brain. So the risk factors are obviously the most important risk factors are genetics, that is having a family history of schizophrenia. The closest the person is genetically linked to a person having schizophrenia, the higher his or her chances are. For example, if one of the pair of a monozygotic twin is having a schizophrenia, then the chances of the other part of his monozygotic sibling of having schizophrenia is as high as 47%, which is almost nearly 50%, which is a very huge amount, huge risk factor. Similarly, if a person is having say a person's father has schizophrenia, then the person has approximately 12 to 13 times higher risk of having schizophrenia compared to the general population. Similarly, if a person's son is having schizophrenia, the person has 6 times higher risk of having schizophrenia. So in a nutshell, the closer you are to a family member having schizophrenia, the higher your chances of having schizophrenia are. So this is about the genetic risk. However, it should also be understood that having someone with schizophrenia in your family does not mean that you will definitely be having schizophrenia, because say for example, if a person is having a parent with schizophrenia, there is 10 to 12% or 10 to 12 times chance of the person developing schizophrenia, but at the same time there is 85 to 90% chance of the person not developing schizophrenia. So basically, the person who has someone with schizophrenia in their family, they need to be very alert and aware as to the warning signs which I had just mentioned, and if they can see any of these warning signs appearing in themselves or in their near and dear one, they should immediately contact for help. So these are about the genetic risk factors. Apart from that, there are environmental risks. For example, when a person is in utero, like before birth, in the process of pregnancy, if there are maternal infections, sometimes it can give rise to higher the chances of developing schizophrenia. For example, if the person before being born, while in uterus, if the birth is in winter, then it has been seen that the chances of schizophrenia are higher. Similarly, there are certain environmental conditions, for example, migration to a different country, to a different culture, and growing up over there increases the risk of schizophrenia. Similarly, smoking cannabis. Cannabis has become a very commonplace thing to be smoked nowadays all over the world, including our country. So, smoking cannabis increases the chance of schizophrenia at a very high rate. For example, if the person is smoking cannabis before 18 years of age, if he starts before 18 years of age, the person has a 4 to 5 times higher risk of developing schizophrenia. On the other hand, if the person is having cannabis after the age of 18, then the person has a 2 to 3 times higher risk of developing schizophrenia. Similarly, environmental stress, childhood abuse, trauma in the earlier part of the childhood, disturbances in the family, all these things can increase the chances of having schizophrenia of a person. So again, in a nutshell, both the genetic factors as well as the environmental factors are very much important in increasing the chances of a person having or developing schizophrenia. And what is the age at which people commonly present with schizophrenia? This we have to understand that schizophrenia usually, like in most cases, is evident in the late adolescence or early adulthood. It appears early in males compared to females. For example, in male persons, usually the first onset of symptoms happens somewhere between 17 years to 25 years of age. On the other hand, for females, the first appearance of symptoms occur somewhere around 20 to 30 years of age. In fact, in females, there is another peak, a second peak, which happens around 45 to 50 years of age. That is around the period that a female stops menstruating or the menopause sets in. There has been a peak has been noted of onset of schizophrenia symptoms in that age also. There are some specific varieties of schizophrenia, for example, hebephrenic schizophrenia. This onset happens much earlier, around 14-15 years of age, often it happens, and by 17-18 years of age, the disease is pretty advanced. So, this is about when the age of onset happens for schizophrenia.